swine flu is basically the influenza virus that mostly has affected pigs in the past, and it's something we deal with regularly in pigs. What's less common now is that we've heard of a number of cases in humans. In Mexico, there have been approximately 80 deaths as of this morning. There have been about many hundred, probably over 500 to 1,000 cases of pneumonia, a mortality rate of about 5%. We cannot equate that to what's happening in the United States. So far in the U.S., there have been no deaths from this, but there have been case reports in New York City, in California, in Texas, and in Kansas. How worried should people be, or what should they be doing, if anything? Well, I think that it's appropriate to be concerned right now, but we don't want to panic. The reason we want to be concerned is because this looks like it's a new strain of swine flu. And whenever we deal with something that's a new strain, that means there's probably not background immunity. And immunity is something that we'd like, because that can limit the spread of infection. There's many things that we can do in order to try to protect ourselves as individuals, as families, and then as communities. And some of those are, if we start hearing about swine flu in our neighborhoods or around, we want to obviously try to avoid crowds. So what we call social distancing. We want to try to, stay at home. Again, this is only if we start hearing about cases in and around. And for instance, in Massachusetts, so far there have been no cases that are reported. But we do want to have heightened surveillance so we can detect any cases early. Meticulous hand washing with either alcohol-based gels such as Purell or Calstat, as well as soap and water. Either of those. Having masks potentially available, loose fit masks in hospitals, the possibility of having more tight fit TB masks available may be helpful as well. It's still not entirely clear the precise mode of transmission. We do know through close contact, either through shaking hands or coughing, sneezing on another person. What will they be doing at South Shore Hospital now, tomorrow, or this week? It's different, anything? Well, absolutely. One of the things we're making sure is that we have supplies that are well stocked on each floor, making sure again that our Purell dispensers, which are alcohol-based gel, whether those are well stocked, that we have the right masks on each floor, that we are making sure that we are trying to detect any influenza-like illness, especially if they come in multiple households. We have to be on the lookout for healthcare providers that become ill with influenza-like illnesses, because that's one of the early detection signals that can tell that you have a potential outbreak that's on the increase. I think we have tools in place that can help us. I think we're probably better prepared than we were in 1918. We have better infrastructure. At the same point, an additional concern is that the world is a smaller place in a sense. Even though there are more people, it's a smaller place than it was in 1918 with commercial travel and such. So I think it will be a work in progress to see how well prepared we are. But we do have to take this seriously.